Welcome. This is the Second Opinion Sports Medicine Podcast, and I'm Dr. Dhokal.
And I'm Dr. Glass.
DG, how's it going today, buddy?
Good. Bright and early, ready to go.
You know what? I am more of a night owl than a morning person, but I kind of like starting my day off like this with you, man.
Oh, yeah, me too. This is good.
Feels fresh. I woke up. I was taking a little cold shower to wake up. I had a late night and decided to turn the hot water to cold water and got a little fresh and was thinking of all our topics. And I'm excited to talk about a couple things with you because this weekend I saw at least one thing in particular, Dustin, where I was like, man, I wish I was watching the game with you so I could just have a live conversation. So we'll have it post stacked, but
yeah.
I'm excited, man. How was your weekend? What did you catch sports med wise?
Weekend was good. We were traveling. I was in Tennessee with my daughter, so that was good. So didn't get a lot of games, but got home Sunday. Did get to watch the Bills New England game, which was kind of an exciting game, depending on who you were rooting for. But yeah, New England's having troubles this year. They were 1-5 in that game and trying to get a home win, and so they pulled it off.
Yeah, it was. It's been rough for them, right? Bill Belichick, known as one of the greatest coaches, and their team's been struggling. And so for Patriots fans, that's probably hard to watch. But I will also say, y'all got 7 championships, so you guys can have a couple average years.
Right.
Welcome to the rest of us who just struggling to make the playoffs.
Yeah, for sure. Yeah, no, but yeah, no, it was his 300th win that game. Belichick's 300th win that puts him in second in all time behind Don Shula. So yeah.
And Shula like 324, I think, or 320.
Yeah, it's I looked it up. Overall, 328 in the regular season. So
yeah. Dude. So a couple average years for him, and he'll be there. And I heard he got his contract extended in the offseason, which what I thought interesting about that was a lot of times people get their contracts extended and it's like news the next day,
Right.
Patriot way. Like they did that in the offseason and it just somehow leaked out or somebody found out about it. So
I didn't realize this is his 49th season in the NFL.
What?
Yeah, 49 seasons. That's a lifetime, man. It's his 28th as a head coach. He had 4 with the Browns and then the rest with New England. But yeah, that's crazy, right? 49 seasons.
I can see how that could happen, though. I mean, any sport that you're involved with, you have love for. I have particular love for football, and I could see those relationships and that passion and that experience just adding up and adding up. They were talking about the Bills Patriots game this last weekend. I think most people would say the Bills are the better team.
Mm-hmm.
What I was thinking about when I was running some errands was, well, Bill Belichick has faced the Bills twice a year for the past decade plus, right?
Yeah.
And so you do learn tendencies of what people are doing, how people perform, how they play against you. And so I think that played a big part in what most people would call like an upset win,
Yeah, for sure.
Yeah. What a man. Hats off to him.
Yeah, and for sure. Yeah.
He's beaten a couple of my teams that I wasn't pleased with, but you have to respect talent, that's what it is.
Yeah. It's been rough for them though since Brady's left, he definitely got a losing record without Brady. So
sure.
But it is what it is.
Yeah, it takes both. I think the debate is silly about, who's better, the coach or the quarterback. You need both, like Patrick Mahomes wouldn't be him if he didn't have Andy Reid. I don't care what anybody says. You put Patrick Mahomes with, I don't want to disparage some coach, but with somebody else, it's not the same. And yeah, I think it takes both, man. I mean, I don't think Michael was the same without Phil, and I don't think, I think coaches matter. I think players matter. I think you grow together and, become who you are. So, yeah, it's pretty amazing the run they had.
Yeah, for sure. Well, a good example. Well, there's a lot of factors that play into it, but McCaffrey, with who was he with Carolina? Going from Carolina now, look at what he's doing with the 49ers. I mean, totally different. I think I read he's had 10 consecutive touchdowns I
Dude,
mean,
more
10
data.
games, 10 straight games with a touchdown. I think 12 overall or something like that. So as the 49ers,
Yeah. I thought it was maybe like 14 because I saw like a
maybe.
sports betting thing that said
Mhm.
14 games ago or whatever, if you bet $100 on McCaffrey scoring a touchdown and you kept rolling it over. So
Yeah.
second you win, second game you put 200, third game
Yeah.
you put 400, et cetera, et
Right.
cetera. After 14 games I saw last week, you would have made 450 some thousand dollars on $100 that you had the balls to keep rolling over. Because I think you're at 8,000, Dustin. You're probably not like, I'm putting 8,000 on Christian
Right.
McCaffrey scoring this week to double it to 16, right? So, yeah, I thought that was interesting too. But injury wise this weekend, what jumped out at you, Dustin? Did something in particular kind of shock you or catch your eye?
Well, the alarming one was the hip injury to who was it?
The Lions running back?
Yeah, the Lions run back. I know we've talked about so many different injuries over the last couple of days, so
Yeah.
they all kind of blend when we're on this podcast. But yeah, the Lions running back. The thing that was the first report when I was reading it over the weekend, how he left immediately, carted off, and then surgery before the game, even ended. So that without knowing anything, you start speculating and trying to figure out why they would do that. And the first thing that came to my mind, well, it had to have been some kind of vascular or nerve compromise to have to go into immediate surgery like that. So,
Yeah, I wanted to talk to you about that because I had heard about you kind of brought that to my attention, and
Mm,
I did a quick look of it and scan of it. And yeah, the Lions running back, his name is Mohaed Ibrahim, and they said he dislocated his hip. And so with that, immediately I thought of Bo Jackson,
yeah.
famous hip injury that turned into a hip pointer, turned into some avascular necrosis issues, if I recall. Avascular necrosis is like,
Mm.
lack of blood supply to the bone. And so it causes, how would you
Bone,
describe that? Like deadening of the bone?
yeah, the bone basically doesn't get the nutrients it needs. So
Yeah.
it's kind of like, you got a hose going to a lawn. And if you cut off that supply of that water going to the lawn, the lawn starts to wither and die. Right.
Dude,
Same
great
thing with
example.
the hip. So that's
Yeah.
basically what happened. He had a dislocation and it compromised the blood supply going to that bone, and eventually started dying off.
So when that happened on the field, well, one, I want to ask you if you've had any experience with such a significant injury. We talked about a dislocated thumb in our first experience on
Mhm.
not an NFL field, on a football field.
Yeah.
Um, and I think a dislocated shoulder is different. I would feel less anxiety and more confidence with a dislocated shoulder to, set that back if it was an emergency situation. That's what needed to
Yeah.
be done. But a dislocated hip, Dustin, walk me through that.
Yeah, that I haven't seen that one in person. We've obviously been taught about them in our schooling and education, but never seen one personally. Knock on wood, thank goodness. It's not something you want to see necessarily, because it could be a medical emergency. You got hours to get that relocated and treated and assessed properly to make sure you don't do any long lasting damage. So but yeah, 90% of them go posterior, so
Mhm.
basically a force, pushing it back in the socket. So and that's a it's I've heard it's one of the most painful things to have
Yeah.
done and to have relocated.
I have
And
a
yeah.
Go ahead.
No, and like the shoulder, you could, basically most times relocate it and get it back in, on field or in the clinic. You definitely want to get to the hospital, make sure everything's checked out. But with the hip, it's typically because it's such a big, powerful, strong muscle around that socket. You typically need medical assistance to get that back in.
Sure. Yeah, I was going to say, I had a patient who was younger, had a congenital issue that he didn't find out about till he was in his 30s, really. Had a lot of hip pain. So we tried all the conservative methods, from physical therapy to laser to, soft tissue mobilization to adjusting. Eventually we took imaging and it showed he had this issue where he had like chronic arthritis, basically enough to where the doctor said that his hip presented as like a 65-year-old man, and he was in his 30s. Long story short, he ended up having a hip replacement after a little bit of debate and some delay. He was trying to avoid that situation, and he had the surgery, Dustin, and he was like, almost immediately, I'm so happy I did that, because his pain level pre-surgery was so high. Moving for him was difficult. Active guy, was having a lot of problems. Even sitting down on my adjusting table, when you go to side posture, it was really difficult for him to be on the affected side. And so he had the surgery. What happened was he got the new hip, and he ended up having a little bit of a misstep, and he redislocated that new hip.
Oh, man.
And so when that happened, he was telling me how he was just like excruciating pain, like excruciating the way he was describing it. And, 911 situation, they took him in. They ended up having to do another surgery on that hip because it kept slipping out. So he got it corrected. And then he had the other hip done like 2 years later. So he's had both hips done, and he's happy as can be,
Yeah.
In this situation with Mohamed, I'm assuming they took him to the hospital to sedate him to put that hip back, wouldn't you say?
Yeah, so more than likely, but they said that he had to have surgery. So,
Mm.
and that's not as, I mean, that is something that they do if it's very stuck. So basically what they do is remove part of the trochanter
Mm-hmm.
on that hip, and remove a piece of that greater trochanter, and allow for more room to allow that the head of the ball and socket to fall into place easier.
Yeah,
So kind of a decompression to allow it to move. So
that makes
it had to have been dislocated enough and wedged enough to where a simple relocation
wouldn't have done it.
was not possible. Yeah.
Yeah, no, that makes sense. Yeah, man, that must have been crazy, because on the replay I saw the Lions players were. So what happened was he was returning a kickoff, a kick return. He returned it like 20 some odd yards. He got tackled, and immediately the players were like, it's bad on an NFL
Yeah.
football field when immediately players are like,
Yeah.
get over here to the sideline.
Yeah.
And actually, I saw one of the guys was waving to the opposing team sideline, which to me, I was like, oh, shoot. Like,
Yeah.
you start waving to the opposing team's medical staff because they're
Yeah.
closer to you.
Yeah.
There's something going on. It kind of gives me the chills right now just thinking about it. I really felt for him, the young man.
Yeah.
Because for him and his family, you're wondering, is his career over? To take
Yep.
it to another level, besides sports injury, it's like
Right.
on a human level, is my career over? Am I done now? Like, those
Right.
thoughts go through your head when you're on the field, I'm sure.
For sure. Yeah. They're all brothers out there at the end of the day. And when the guy goes down and there's a kind of a war cry that happens, everybody knows, that
Yeah.
something's up, and the whole game changes at that moment. We've seen it with, different types of injuries where the game suddenly changes on the field, or the emotions change,
Yeah. Yeah.
So there turns into concern because they know it could happen to any one of them. And they say, like they say, you play like it's your last, game. You never know, right? So, and
Yeah.
then when you got a guy in that much pain, something's up.
Yeah. Yeah. My heart goes out for him. I'm going to be following his return hopefully next season. Um, yeah. Prayers out to Mohamed, man. Hopefully he bounces back and is able to suit up again and play and doesn't have any long-term repercussions from this injury. Um, you know, we've been talking about quarterbacks a lot this season. It seems like more than last season.
Yeah.
And I was wondering if that's just a normal thing. Is it every year there's, a third of the quarterbacks are going down or dealing with something? And part of me felt like, yes, they're the most valuable player on the team, perhaps, and everyone on the defense is looking to kind of put that guy down, not injure him, but, get him off his game. And then my second thought was, man, it seems like this is an unusual year in the fact that we've had so many quarterback injuries and just the severity of them, whether it's the Achilles tear for Aaron Rodgers, or whether it's what I was going to bring up now, which is Deshawn Watson, the Browns quarterback, has a shoulder injury. He's going to be out for a few weeks. So yeah, these QB1s, there's a lot of them going down. Justin Herbert has the busted finger and the, torn nail. He's had a couple rough games, and I'm sure that's affecting him too. I think fans forget how much these injuries, even if you're on the field, you might not feel 100%, right?
Right. I don't think any of them feel 100%. It's a combat sport, right?
Yeah.
Every single play is like a street fight, especially in the trenches. But you're getting hit at a high speed and a lot of force on a regular. It
Yeah.
takes a toll. So
Yeah.
I think the injuries are. I think the injuries have always been there for these, but the athletes are so much faster, bigger, stronger, and I think we're protecting them more. And I think that's changed the game a little,
Mhm.
where because we're protecting them more as a league, they are having to report more, right? Because
Sure.
old school ball, they're not protecting them as much, and so you're not reporting it. There's nothing to report, right? Because you
Yeah.
get banged up, it's part of the game. You get back out there, nobody's thinking twice about it. But now, because you got rules, all these different contract stuff, it's just so the reporting is a lot more, I think.
Yeah. The documentation has to be there, right?
Yeah. So
I want to get your opinion on Deshawn. So they said a shoulder injury initially. I think it was like a shoulder strain situation. They were, as I understand it, they were kind of saying, well, he might have a possibility of playing last week. I did a little further digging, and it says that he has a subscapularis strain. And I have believe it or not, a patient who's a Browns fan. He's from Ohio, and he was asking me yesterday, I've never heard of a subscapularis. Like, is that a shoulder muscle? That sounds like a scapular muscle. I said, well, you're right about that. It is, but it's all, your scapula. I was explaining to him, your shoulder blade is an important component of your shoulder joint, right? And so I was kind of breaking that down. I just wanted to bring up some of the rotator cuff muscles and maybe talk about my understanding of a difference between an acute injury and a more chronic injury. So with the shoulder, you have the subscapularis, commonly known, as the sits muscles. That's kind of how we remembered it in school. So subscapularis, infraspinatus, teres minor, and supraspinatus were the four muscles. And with Deshawn, it seems like it's more of an acute issue with the strain of the subscapularis. And this particular patient actually had a shoulder injury, but an AC joint injury. And I was saying to him, tendonitis is a little different because that seems to have a gradual onset, at least in my experience, where somebody has shoulder tendonitis or shoulder pain, typically they're telling me it started a few weeks ago when I was doing bench press. I was doing this thing. It's gotten worse. It started at a 3, now it's a 5, now it's an 8, and now I
right.
can't move my arm. Versus an acute injury like a sprain strain typically is like, well, I was doing a clean and jerk and I just felt it right away and now it feels terrible. It was a 0, now it's a 7. So that's kind of how I initially, when I'm talking with somebody, start my thinking process or my thought process of, are we dealing with like a tendinopathy, or are we dealing with like an acute injury? What are your thoughts on that particular those particular diagnoses, and what do you think about Deshawn's shoulder?
Yeah, with Deshaun's thing, I think it'd be interesting to see because he had an injury. If going back and looking at his history, in week I think 3, around I think it was the September 24th, he
Mm-hmm.
injured his shoulder and he was out. He's been out the whole time.
Yeah,
This was his first week back, and he hurt his shoulder again.
you're right.
So as far as acute versus chronic, I think this part was an acute. Now it's kind of like you were saying with your patient. Patients come in and will tell me, "Oh, I have a history. I injured my rotator cuff." Okay, great. Which one? And then they look at you like, "What do you mean, which one?"
I left one.
Yeah, exactly. And I'm like, "No, okay. Well, it's made up of several muscles. Which one did they tell you?" And they're like, "Oh, I don't know." So it's one of those things. It was reported that he strained his rotator cuff, 4 or 5 weeks ago, but we don't know which one, right? So this one, subscapularis, they're actually talking about, could be acute from this last week, right? But
Mhm.
he's been dealing with, issues for the last 4 or 5 weeks, trying to get back. He was medically cleared after the first one, but opted not to return. So that was kind of interesting. And it was reported he just didn't feel, comfortable enough to get back in to play his full potential.
Hmm.
So that's understandable. You got to give him hats off, because a lot of times in this day and age, they're just going to suck it up, fill it up with meds, and try to get
Yeah.
out there and do further damage. He was trying to actually do the right thing because he knew he had a bye week coming up. So they were playing that rest game,
Right.
and so you would think everything went well, but that just goes to show with rehab, you know, as soon as you start changing the mechanics, other things can come up. That subscapularis is an internal rotator, internal shoulder rotator. So it could have been one of those things where from his original one, he was compensating from one of the other rotator cuff muscles not
Sure.
functioning 100%. Now he's having to overwork, over internal rotate, and then strain that. So
Right.
who knows?
Yeah, you end up loading up another aspect, right? So you have four components. One of the four components is weak. The other three components are going to have to pick up that slack, and over time that creates strain.
Yeah.
I had a baseball pitcher who had an elbow issue a couple weeks ago, and we were talking about velocity and we were talking about strength. And I think that conversation also parallels this shoulder injury with Deshawn in the sense that, is it torn and can you throw? It's probably not torn. You probably can throw, but it's a pain issue, one. And two, as a quarterback, there's two important things. It's the velocity in which you throw, and it's the accuracy in which you throw, right?
Right.
At least two of multi components. And so both the velocity is going to be affected, but also his strength, right? And so as a quarterback, if you can go through the motion, that doesn't mean that you're actually able to perform at the level at which you need to, because just because you can go through the motion doesn't mean you have the same velocity or you have that same strength in the arm, right? Due to the
Right.
weakness and injury. So yeah, you have to be really mindful, and it's such a dance between wanting to play and, like you said, playing and maybe creating something worse.
Yeah.
It's one of the toughest things that I think we do as sports physicians, is to help players figure that out. And me being on the personal side, I don't have the final say, but I do feel like I have the ear and the trust of the athletes that I work with. And so it's hard, man. You always want to say, "Hey, get on the field." And I sometimes personally feel like, wow, I didn't do enough to get this person on the field. But the reality is sometimes there's limits to that, right? And there's a timeline. So you can't
Right.
rush things. Yeah. Have you had a
Right.
difficult time? Can you recall a time in the past where you were trying your hardest to get somebody on, and it's just the timeline wasn't there? They needed more time. And do you recall feeling any type of way about that?
Yeah, it's always kind of that balance where you're trying to help make that decision, and ultimately, and it's usually, it's kind of funny because with the pro teams you have a whole staff, right? So it's not just your decision. In our private practice, we're a lot of times making that decision for these high schoolers or youth
Sure.
sports. And so that's where it gets a little more where you have to, and it always comes down. Like I had a conversation yesterday with a young athlete, and I said, listen, if this was, your senior season,
Mm,
last game, CIF,
mm,
this is something that you could play through. He had a little costotransverse, pain, on the backside of his back. Very painful, very uncomfortable, but it's not injured, right? So it's one of those things where we can set it, we can get you feeling better. It could be moving, but you're not injured. So could you play? Yes. But right now it's the beginning of the season for basketball. There's no need to
mm.
go out there and aggravate it if you don't have to. Now you could still go to practice, work on defense, work on dribbling, but anything overhead, you're going to aggravate it. So no need to, right? But again, if it's end of your years and you need to get out there and play, you could play through this. So that's kind of how the conversation goes, and you
Yeah.
hope you make the right decision.
Yeah. It's an important decision for the athlete, and I take a lot of I don't know if pride is the word, but a lot of importance, seriousness. I reflect on these decisions and really make it a conversation, right? So it's not like a black and white thing where thumbs up you can go, thumbs down you can't go. It's like, well, let's talk about this.
Yeah.
How do you feel? What are the positives of playing? What are the negatives if you play? And really going through that checklist. Sometimes with the parents if it's a younger athlete too.
Yeah. for
So it
sure.
becomes a group discussion.
Yeah, it's always tougher when the parent's the one pushing it.
Yeah.
Like, and the kids all, "I'm okay sitting out," and the parents all, "Well, you could probably do this and this," and you're like, "Man,"
Right.
then I have to stick up for I always stick up for the kid,
Yeah.
because
Yeah. Yeah.
sometimes it's parents behaving badly and they just don't really see it, right? And
Sure.
I'm like, "Oh, they're 12 years old. They really could miss a game. It's okay."
Yeah.
Especially when the kid wants to miss a game,
Yeah.
So,
You know, yesterday I was at the park. I took Kuma to the park to get a little outside time, just let her get some sun and some grass. And I laid out a towel and we were just kind of hanging out. I had to do a couple things on my phone work wise. So we were chilling. And there's a youth flag football kind of camp going on. So there's like um, clearly like an ex football player as the coach of some sort, maybe college or something, and he has all these little kids there, Dustin, like talking like, I don't know, first grade, 4 or 5 years old, 6 years old, maybe. There's one kid swagged out, has the shorts, the gloves, the
yeah.
wristbands, like the whole nine. He's looking sharp. He was terrible, by the way. He was terrible. He looked the part.
Yeah.
Um, but the reason I'm telling you the story, there was a young kid who, looked like if I was to peg him when he got older, he'd be like an offensive lineman or defensive lineman.
Mhm. Yeah.
Um, and his grandpa, seemingly, I think, it couldn't have been his dad, was trying to kind of coach him up before practice. And his grandpa was like playing quarterback and was like telling this kid how to run routes, and it was cute, but it was also comical because I don't think this grandpa's ever played football before. He definitely hasn't played quarterback before. He was throwing the ball. It was like,
No. Oh,
you
no.
know, but he was getting mad at at his grandson because he wasn't running tight routes. And mind you, this kid's like first grade, and he's like, I need you to go 5 steps, 90-degree turn inside, and then turn and then have your hands. And when the ball comes, have it under. He wasn't even giving him really quite good instruction, to be quite
Yeah.
honest, but he's having fun with his grandson. That's the most important thing. Um, but it was funny to me to like watch this interaction of like somebody who has love for a sport as a grandfather trying to give some like tips to his grandson. And his grandson was getting frustrated. He's like, "You're not
Yeah.
throwing the ball
Yeah.
good."
That's great.
So it just made me think, if I'm ever a parent one day, like I got to make sure not to be that guy who thinks he like knows it all. Like defer to the coach.
Yeah.
They're a coach for a reason. You can be a parent and parent your kid, but you've had
Easier
a lot
said
more
than done.
experience.
Easier said than done.
Right. I was gonna say
Yeah.
you have a lot more experience with that, right?
Yeah. We'll replay this when you're in that position and all, when you're
Right.
out there pushing the coach aside.
We're like, that's a terrible play call.
Yeah.
Why did you check down? My
Yep.
boy can throw the deep route.
Yep.
Yeah, that might be it. Well, I might need you by my side. Just put your hand on my shoulder and say,
There
"Yo,
we go.
chill out."
Yeah, I had a coach do that to me once,
Did you?
early on. Yeah, he had kids, older than mine, and this was my first one, and
Yeah,
I'm just chirping and barking the whole time at my kid, and
young Dustin.
he came over and sat right next to me. I was coaching on the third base side, and he sat down right next to me, and he's all, "You never shut up, do you?" I'm like, "What do you mean?" And he's like, "You're constantly talking to her. You just like give it a break. She's 10 years old." I'm
Oh
like,
my goodness.
yeah, it was a reality check, and from there on, he was right. Like, what am I doing? Like, I'm
So you didn't even
constant
realize it.
every because she was pitching at the time. Every pitch, I was saying something, and it
Wow.
wasn't necessarily good stuff. It was like trying
Sure.
to make corrections. It was like I was playing a video game, right? But you
Oh my
can't
goodness.
help it. And man, but he
Yeah.
just quietly came over. He was a cop, and he just came over, and he's all, "You don't shut up, do you?" Real quietly, real calmly. "You never shut
Yeah.
up." I'm like, "Oh man."
You're like, yeah,
Okay.
I'm gonna zip it. Well,
Yep.
sometimes you have these thoughts, right? And you just verbalize them. It's like, I'm sure it wasn't malicious in any part.
No.
You're like just thinking out loud
Yeah.
and passionate. That's my
Yeah.
guy.
Well, they can do better, right? You know what
Yeah,
their potential is, but
sure.
you also forget that they're 10-year-olds,
The
and
kids.
they're trying to figure it out too. So, yeah,
Yeah.
a lot of learning curves with parenting, that's for sure. I've apologized to my oldest many times. Each the other ones I've learned from, so they get the benefit of me screwing up with the
Sure.
oldest. So,
The
but
older. That's a cute story. It's funny.
yeah,
Well,
yeah,
I'd like to bring up one other injury, Dustin. I know we both have some morning home visits today,
yeah. I
but
got to get going, but
let me ask you about one thing real quick. There was a torn pectoral muscle
yeah,
with the linebacker for the Seattle Seahawks. His name's Uchenna Nwosu. Used to be on the Chargers. Had the pleasure of knowing him. And when I heard about this injury, I was really, really bummed for Uchenna because he's just a passionate guy. You know, sometimes you know some people and you feel bad when there's a little bit of a personal aspect. But injury specific with the torn pec, that is a major injury. I've actually had another linebacker who tore his right pec 1 year, rehabbed it. The very next year, tore his left pec, rehabbed it again, actually, with one of the physical therapy modalities that I have. And it was, to be quite honest, it was his experience with this machine that made me get it. Because he said, P, after my first pec rehab, it took me all season. I tore my second one. I used this machine and it got me back. So I didn't have to miss the whole season. And so knowing him and trusting him, that was all I needed to hear to take the next step and invest in this machine. But with
what was the machine? What was the unit? Was it the ARP?
It's called a ARP wave, ARP wave. It's like a direct current stimulation, electrical current stimulation. And there's a couple other brands. That particular company is who I use. Technology's been around for a while, but I've found it really effective for healing injuries and also strengthening, weaknesses.
Perfect.
So I'm going to definitely get a hold of Uchenna and recommend that he, as soon as he can, add that to his rehab protocol.
Yeah.
I wanted to ask you, a torn pec, well, I know kind of how it happens, the mechanism of injury with him, but have you seen that before? And like, what's your initial thought about that injury and how that happens, I guess? And and like, what is that rehab process?
Yeah. So it really is an uncommon injury. We see it quite a bit in football and in bodybuilding, but in the real world, if you want to say, it's not a very common injury. But like we talked about it, I think last week or the week before, another player had one, and I've seen them. Both the pec. The thing is, the pec, especially the pec major, crosses over that shoulder and underneath that deltoid, the side shoulder muscle, and then the bicep tendon goes underneath that too. So you got these like three things going on that you have to do a differential diagnosis. Usually a pec tear is pretty obvious. You get the deformity and you get the big bruising. So it's pretty, when you see it come through, you know exactly what it is. But and it usually happens during an eccentric load. So when the maximum contraction and then you're coming out of it and a forceful push on that eccentric load. So these guys are coming full force with a tackle or with, the lineman, contracting, and then something shifts that weight where they're eccentrically loading. That's when you're going to get that tear. That's why you see it in bodybuilding a lot.
So let me pause you there. So with that, it's really like you're contracting your muscles, meaning you're shortening your muscles because you're about to perform an action like a bench press. You're shortening, or you're about to hit somebody as a linebacker. And then as that muscle shortening under force, another force comes and goes against that. And now you're contracting and shortening it, and something lengthens it. That's the eccentric. So it's this duality of you're contracting and something overpowers it and elongates it and just gives it out.
Quickly. And great. That was a great way to describe it. So that's when you're going to get that tearing, and it happens sudden, fast. That's why you can't always predict it. It's always usually a surprise. There's tons of videos online if somebody wants to go see what one looks like. People bench pressing and it going, you can see
that's the first thing I thought of.
It is not fun to watch or see because it just fails, right? But the recovery is a long recovery. It's a hard one to recover because you're in the sling for about 8 to 12 weeks, just in the sling. So you're immobilized for 8 to 12 weeks. So that's a few months there that you're out of commission, and then you got to start getting the range of motion, so and then it's you're out about a year and a half of full rehab. It takes about that full year to then start strengthening it actually, so it's a bummer. I don't know how else to say it.
No, it is. It's one of the more devastating injuries. I make an analogy that it's like just as bad as an ACL tear to me, you know?
Yeah.
Depending on the position, if you're a receiver, you don't want an ACL. I would counter if you're a linebacker, that upper extremity strength is just as important. And, it's mid-October, almost the end of October. So this injury just occurred. I was kind of doing the math of when preseason starts next year and when you want to be kind of at 100%, which would be July. If you're not at 100%, say like Brock Purdy had his elbow injury, he had surgery on his elbow. He wasn't quite 100% at the beginning of July or the end of July when camp starts, but he was able to be available for the first game of the season. So doing the math, Uchenna has about 10 months, 9 months until the summertime. Come March when camps open, training camps, OTAs, organized team activities, he won't be 100% at that point in time. Not to put limits on people, but that's really a short timeline.
Yeah.
So I think he has a pretty good shot at in my opinion, being ready to go for the beginning of next season. That's what I would set as my target of like, okay, we're going to be right for the beginning of next season. And it might push right into preseason, perhaps,
Yeah.
to those final stages.
Yeah. If it's going to happen, this would be the best timing, versus a few more weeks into this. So yeah, if he's in town, get him in the hyperbaric for sure.
I'm going to reach out to him. He's in Seattle now, so I don't know. He'll probably has, all the Seahawks team staff working with him. But if he comes back out to California or during the rehab process, I definitely will mention it because I'd love to get him in the hyperbarics in your office, or at least recommend him see somebody out there in Seattle.
Yeah, and I can help anybody locate somebody else too anywhere.
Okay.
But it's so hopefully that one clears out good for him, and wishing him the best of luck.
Yeah, I'll follow up with him. I'll if I hear from him or have some updates as far as how surgery or rehab goes, I'll give you updates on that. And I was just going to say, there's no reason once he gets through this initial acute stage, he'll have some time. Maybe he'll do us the honor of coming on the podcast and breaking down kind of what he went through.
Yeah, that's true. That'd be a good one. Get his perspective on everything. For our listeners, pec tear doesn't necessarily always mean surgery either. I know we're painting a picture of that you have to get that surgery done because of the way it is, but for a lot of people, if they tear it that aren't needing to use that, it's basically, if you're not, what I'm trying to say is there's a lot of muscles around that area that will compensate and take over and allow you to move your shoulder for normal activities of daily living. So you can get away with not having surgery in a lot of cases, depending on if there's a deformity, that's up to you if you want to leave it the way the aesthetically looks. But if it's somewhat functional and you're happy with that range of motion and that function, and you're okay losing that adduction, that motion going in, or that shoulder internal rotation to a degree, and your life is at a point where you don't really need to do that much anymore, then you don't necessarily need to have the surgery. You can rehab it and get the pain down, and your body will take over. But
that's a good point, because once you have surgery, that starts the hourglass of starting from step one in a whole rehab process. So for some people, like you said, if you don't necessarily require the surgery, you might just let it heal and kind of deal with any minor deficit that may occur, with it, if it's not going to affect your activities of daily living,
Correct.
So, well, any last thoughts, Dustin, before we sign off for the week?
No, I know this was a quicker one. I appreciate taking the time and that's getting it done, but I have a lot more to say, but that's we'll have to pick it up next time and continue our normal talk.
Man, if we didn't put a limit on it, we could go for a couple hours each time, telling stories and also talking shop. But today we're limited. I did want to say one thing though before we go. Do you know what today is?
Today is Wednesday. No, I don't. You're sitting back like you know something and you got something good to say. What do you got?
Hey man, we're at episode 40 today.
Woo, man, a little milestone.
Yeah.
I did know that was coming up, and I didn't even think about that. So
We've had more than 40
the-
technically, but the
Yeah.
40 officially that will go live. We had a couple, I guess, practice pods, you could say, or ones that didn't make it into the
duty
universe.
marks. Yeah.
Yeah. But I just wanted to recognize that we're at the 40 mark. Our goal, our next milestone is 50. And I'm really enjoying spending the time doing this week in, week out. And I'm also learning stuff. It's not just I'm, breaking down some infinite amount of knowledge I have. It's fun to kind of research some things out and learn some stuff from my respected colleague and, just in general. So
Vice
I
versa.
appreciate you, man.
Yeah, me too. Appreciate you. This has been fun, and looking forward to continuing doing it. And hopefully, our listeners are getting something out of it. That was our goal, right? If you can get one little gem out of something each episode, or hear one story that made your life different, in a good way,
Yeah,
then it's worth it for us.
no doubt, no doubt. Well, have a great rest of the day, my friend. Have a good week. We have some good football matchups coming up this weekend. I'm hoping the Chargers can right the ship. We've taken a couple L's, and we're a better team than that. So I'm looking to see how we bounce back in the second half of the year. I'm hoping for a week of minor injuries and nothing major. And like I said, wishing you a productive day and productive week, my friend.
You too, buddy. We'll talk soon.
Yeah, we'll chat soon. All right, listeners. Well, thank you for joining us. We really appreciate you. Tell a friend if you enjoyed the episode. And we're always reading the comments. If you have anything you'd like us to discuss, we're open to it. Just share with us and we'll do our best to break that down for y'all. Again, this is Second Opinion. We are the Sports Medicine Podcast. We're the pro sports doctors. I'm Dr. Dhokal.
I'm Dr. Glass.
And we will be back with you in a few days. Take care, be safe, and have a good morning, Dustin. We'll talk soon.
You too, brother.
All right, buddy. Bye.